Hello everyone. My name is Fahim Ridwan Nabil and I will be presenting a paper on COVID-19 vaccination hesitancy and perceived risk of infection among construction workers. Introduction and background of the study. Construction workers working in the industry are already vulnerable to injuries, illness, and fatalities, and the pandemic of COVID-19 made the situation more critical. COVID-19 is very contagious and can be transmitted from person to person via airborne transfer of particles emitted when an infected individual exhales, speaks, vocalizes, coughs, or even sneezes. Recently, according to a research study, it was shown that across all industries, construction workers had the highest positivity rate for COVID-19 virus, with 5.7% of the workers being tested asymptomatic and 10% of the workers did have symptoms. Many workers have been affected by COVID-19 and the number is expected to continue to grow. Workers' abilities are more important than machines in construction industry. Workers are needed to be on site to carry out their duties or ensure that work is done properly. The virus has affected every industry in the US and construction was also affected by the virus. The chart on the right side shows daily trend in the number of COVID-19 death cases in the United States reported to CDC. In US, among other industry, the construction industry is considered to be one of the most hazardous industries in terms of workplace fatalities. The number of reported fatalities for 2019 for construction workplace was 1,061, which means that every 8 hours, one construction worker died in a fatal accident. With the spread of COVID-19 pandemic, the situation has been more worsened. Research objective of the study. There was 4 research objectives in the study. The first one is investigating the risk perception of construction workers based on vaccination status, finding the construction workers' vaccination rate, contraction rate of COVID-19, and vaccination attitude for COVID-19. Research methods. The research goal was achieved in 4 steps in this research. The first step was to do an extensive literature review. The second step was to create a questionnaire. After the preparation of the questionnaire, IRB approval was also taken. The data collection work was conducted in the step 3. All the data were collected across active construction site in North Carolina. For step 4, the collected data were integrated and statistically analyzed using SPSS. The data analysis is divided into 2 sections. The first one was descriptive analysis. It was done for demographic information and other related information that were collected from the participants. And the other is calculation of risk perception using individual sample t-test. Data analysis and results of the study. Descriptive statistics results are shown in this slide. 43 participants were interviewed during the process. Participants' minimum age was 21 and the maximum age was 61. In terms of experience, the minimum experience of the interviewed participant was less than a year and the maximum was 61 years. 93% of the participants were male, 7% of the participants were female. 25.6% of the surveyed participants were COVID-19 positive and 74.4% of the participants were COVID-19 negative. 51% of the surveyed workers were vaccinated and 48% of the surveyed workers were not vaccinated. An independent samples t-test was conducted to compare the perception of COVID-19 risk between vaccinated and unvaccinated workers. Result revealed that there was a significant difference in perception of COVID-19 between the vaccinated workers and the unvaccinated workers. The p-value was less than 0.01. Workers who are vaccinated tend to think COVID-19 is a risk for them. Conclusion of this study. So, the conclusions are simple. Workers' safety attitude and risk perception play a critical role in preventing casualties at construction workplaces. The current study shows a relationship for perceiving COVID-19 as a threat among vaccinated and unvaccinated construction workers. As COVID-19 is an invisible threat to construction workers' health, safety, and environment, this study will help researchers to understand the construction workers' attitude toward making the construction workplace safer. The results that shows that there is a strong relationship between risk perception and vaccination status, and it reveals that unvaccinated workers tend to not consider COVID-19 as a threat. Therefore, awareness and safety programs can be organized targeting unvaccinated construction workers to raise awareness. The study results will also help safety managers, owners, project managers to have better understanding of workers' attitude towards COVID-19 vaccinations. The results from the data analysis showed that there is a strong correlation between the vaccination attitude and risk perception of COVID-19. The results suggest that vaccination workers acknowledge COVID-19 as a threat in the construction workplace. I'd like to thank everyone for listening to the presentation.